Hello, my name is Hunter Bosher, and this is the final presentation for the history of public health. Here I will answer 10 questions about my final milestone. The first question is, what is the local community you're designing the initiative for? The local community that I'm addressing is Adrian, Michigan. I attend college in Adrian, Michigan, and I'm a student athlete at the college. I have been directly affected by the public health issue, and that's why I'm speaking about it today. How is this local community unique from other communities in the region? Adrian is a very small town in Michigan. We experience very hot summers and very cold winters. Lenawee County is hard to discuss because I personally have not had a personal interaction with any aspect that would involve serious factors of Lenawee County regarding public health. The issues with small communities is that it's hard to bring awareness. I feel like all the residents here have lived here a long time and have to come to terms with the health issues that are present and are kind of just living with them because they've lived here for so long. This research that I've conducted is to start the investigation and raise awareness. What is the public health issue you are targeting? The public health issue I'm targeting in Adrian, Michigan is the drinking water. The water here has a bad taste, a bad smell, and through my research, this is a result of algae in the water and then chlorine being added to the water to try to condone this bad taste, bad smell, fight the bacteria of the algae. And then how is this issue related to other public health issues affecting the community? The health issue of drinking water can affect the community's health in all. Algae and chlorine are not substances that improve health. The city is allowing substances to be consumed by residents at what cost? The water should be tested more for other harmful toxins that we could be consuming. The health of our residents should be the top priority of the city, and we're having to fight for that at this point. It's hard to say what specific health issues that are being that are affecting the community. One of my sources that I have identified in milestone 4 talks about a chemical that has a result of diarrhea, and I could see that being common in our water. Our water is just very bad tasting, bad smell, and if you drink it enough in one setting, it will upset your stomach. And so those are the different aspects you gotta address, because other public health issues is the community health as a whole. If you're having diarrhea, that can affect the hydration of a person. You can become dehydrated, it can affect that. And then also that continues want to drink more. You want to get hydrated. And so this goes in a loop of you drinking the bad water, you getting an upset stomach, you having diarrhea, and then being dehydrated from it. And then you just want to drink more water. So the next question is, why is it important to address the issue now? I've come to address this because I'm being affected by it. As a student athlete at our practices, our water is filled up with the city water. The city water being drawn from Lake Adrian, we're drinking algae, chlorine, and then possibly other harmful toxins because there has been no testing done on that. With the testing being done, we could figure out other harmful toxins that we could be consuming and then address this very simply. What steps will you propose the community take to address the issue? The community should continue to speak up and raise awareness. We should demand the water to be further tested and find real results. The city should take control and listen to the complaints from the residents. The water is such a vital part of life, and city water can be the only water that some residents have access to. The steps will consist of raising awareness to other residents, all residents complaining to the city, the residents demanding results, and then Even different aspects of rallies or protests can be even initiated. And then hopefully this will result in more testing of the water. And then once we figure out those aspects, the city can implement different filtration systems, different water sources to help the community. What resources will need to be invested to make sure this initiative is effective? Leadership is the only resource that I would personally say that is needed. People need to demand from their city that health is a priority. Residents need to come together and all gather leadership roles to demand more from the city. How long will it take to implement the initiative? A long period of time is not needed. Outreach to the community can be simple as emails, posters put up around the town, surveys being sent out or handed out. After this is done, the community can start meeting weekly to decide their first action to demand more based on their health. How long will it take to see results of the initiative? The results can take a long time. It's hard to say. The city will have to listen to the complaints, start research case, and test the water. Testing can take a long time, and I personally do not know because I'm not a scientist or any sort. I haven't interactions with labs or anything, but testing can take a long time because testing for all of the toxins and trying to rule out everything will have to take a long time, and then also waiting on results from the test can take a long time too. How will you evaluate whether or not the initiative is successful? The evaluation cannot be conducted until results are back. Success can be given a little by knowing that algae and chlorine is in our water for the first step. Once the results come back, we can find out all of the toxins that are in our water to the full extent, and then we can bring action to the city about health hazards. Until then, we will have to follow the steps I suggested above and just keep moving forward and keep being persistent about this health issue. Thank you.